Hey, happy Friday. I hope you're all well today. And I'm doing the Friday installment for PH Awareness Month. My name's Jane Northrup, and my daughter Nicole has the disease. And so today I'm going to talk about the conventional medical therapies, and I have I'm going to read from my computer screen. I hope everybody's well today. So the conventional medical therapies are calcium channel blockers, or CCBs, which help decrease blood pressure. This is only appropriate for a very small minority of patients demonstrating a favorable response to vasodilator testing at the time of the heart catheterization. Hi Linda, how are you today? And there's Digoxin, and that assists the pumping of the heart. And then we have Diuretics, which would be something like Lasix, and that rids excess fluid that puts pressure on the heart. Then there's oxygen, and we talked about oxygen yesterday. And then there's Warfarin or Coumadin, and they are blood thinners that thins the blood and prevents it from clotting. So of those listed right there, Nicole's only on oxygen. She does take aspirin 3 days a week, baby aspirin, but other than that, she doesn't take any of those therapies. So now we're going to get to the oral treatment options, and these are endothelin receptor antagonists, ERAs, and they help prevent blood vessels from narrowing. And the three medications are Ambrisentan, which is Letairis, Bosentan is Tracleer, and then there's these words, I'm sorry, I'm going to butcher these names. Macitentan is Opsumit. And then we have PDE5, and I'm not even going to try to say PDE. No. I'm going to write all this in the above the video, so you'll be able to see this too. And PDE5 inhibitors allows the lungs to produce more of its own vasodilators. And vasodilators is what opens the blood vessels. So the PDE5 inhibitors are Sildenafil, which is Revatio, same thing as Viagra. And then there's Sildenafil, Revatio, for pediatric patients. Of all the medications that there are to treat pulmonary hypertension, and when I say treat, I mean treat. None of these medications will cure PH. They will only slow down the progression of the disease. This is the only medication that is FDA approved for pediatric patients. So when Nicole was diagnosed when she was 15, there were no medications that were approved for pediatric use. So she had to take, as well as most pediatric patients still today, have to take the adult medications. And then there's Tadalafil, which is Adcirca, and Adcirca is the same thing as Cialis. They're vasodilators. Then we have prostacyclin analogs, which allows the blood vessels in the lungs to relax, and that's oral treprostinil, which is oral Remodulin, and it's Oritram, or Renitram, I think that's how you pronounce it. We also have selective IP receptor agonist, which targets and activates a prostacyclin receptor that helps the blood vessels in the lungs relax. And that is Uptravi. That's the name of the drug, but it's Selexipag. And then there's SGC stimulators, which increase the interaction of SGC, with another chemical, nitric oxide, to help the blood vessels in the lungs relax. And that would be Adempis, and I'm not going to try and pronounce the name for that. Then we go into the inhaled treatment options, and those are the prostacyclins, and they relieve shortness of breath. Iloprost is Ventavis, and inhaled treprostinil is Tyvaso, which is inhaled Remodulin. And then we have the intravenous treatment options, and they help open the blood vessels to ease symptoms of PH, including chest pain and shortness of breath. We have intravenous or IV treprostinil, which is Remodulin. And then there's epoprostenol, which is Flolan. And then there's room temperature stable epoprostenol, which is Volutri. And then we have subcutaneous treatment options, and the only subcutaneous one is subcu Remodulin, which is what Nicole is one of the drugs that Nicole takes. So those are the drugs given for PH patients. I'm going to go through all these drugs separately, so I'm going to talk about each one of them, and I'm going to have to double up on some of them because I have more drugs than I have month. And so I'm going to leave it there today. So these are all the drugs for PH. I will start on Monday with another video, and I will talk about subcutaneous Remodulin, which Nicole is on, and I want to make it as personal as possible when it comes to Nicole and the drugs that she's on. So I don't know what I'm going to do for Monday for subcutaneous, so I'll figure it out over the weekend. I appreciate everybody watching. Linda, thank you for watching. Cindy, how are you doing? I hope you and George are well. Hey Morgan, I hope you're feeling better. Hi Gilberto. Yes, so Morgan, you're on Adcirca, Opsumit, and Uptravi. Yeah, so you're on all oral medications. And yes, thank you so much for posting that, Morgan. I really do appreciate it. A lot of patients, I will say this, if you are a PH patient and you're taking, post down below in the comments what PH medications you are on. A lot of PHers are on one drug from each of the categories. So they're on an ERA, so they're going to be on either Letairis, Tracleer, or Opsumit. And then they're going to be taking a PDE5 inhibitor, which would be Revatio or Adcirca. And then some of the newer medications like Oranitram, I know I'm not saying that right, Uptravi and Adempis are all new, and I don't know much about them. So a lot of patients like Nicole is on one medication from each group. So oh, well, I hope you get all your mucus up, Morgan. I really do hope you're feeling better soon. So, yes, I would love to know what medications you are on if you are a PH patient. That would be awesome. And so I'm going to let you go. I don't want to make the video too long. So I hope you all have a wonderful, wonderful weekend. It's Veterans Day tomorrow. Thank you for the service of all the veterans. And I hope you have a great weekend. Love y'all, and God bless.